In this video, let us take some example of pathogens which causes microbial contamination of the food. With help of the organism, let us try to understand their mode of transmission and what are the symptoms. So microbial food contamination may happen because of bacteria. So here various classes of bacteria can infect the food. Examples like Staphylococcus, Cholesterodium perfringens, Salmonella, Shigella and Streptococcus. So let us take example of some bacteria and let us try to understand about the mode of transmission. Let us take the example of Cholesterodium. Very commonly we can come across with food poisoning by the Cholesterodium species. The genus Cholesterodium consists of gram-positive anaerobic spore-forming bacilli which are responsible for three major diseases like tetanus. The organism is Cholesterodium tetani. They are also responsible for gas gangrene. It may be because of Cholesterodium perfringens. Even food poisoning may happen because of Cholesterodium botulinum or perfringens type A and type C. Here we will be discussing only the aspect related to the food poisoning. This Cholesterodium can produce disease only when conditions are favorable. So thereby their invasive powers are very much limited. The pathogenic Cholesterodium can act by releasing some of the exotoxins. These exotoxins, they have some pathological responses. Let us see about the sources. Foodborne botulism usually result from consumption of contaminated preserved food, especially the food like canned meat and meat products, vegetables and fish may act as a source for exotoxin generated from the Cholesterodium species if it is not properly stored. So how we will come to know about the contamination by the Cholesterodium? By observing the substances which got stored, we can observe it. A bulging can be observed. If you observe some of the cans which got stored with meat, if bulging is observed, and sometimes it also produces some peculiar tasting, so thereby we can suspect botulism poisoning. And even if you are opening the can, so there some explosion of the air can be seen. Even sometimes some fluid can be seen oozing out with a pressure from the can. So if such things are observed, so it's definitely because of the Cholesterodium species. So here pressurized fluid can ooze out, but we cannot observe gas moving out. But even sometimes the gas can be observed. That may happen because of the chemical reaction. So it may happen with the detaining of the substances on the can lining. So this is how we can identify the Cholesterodium species. So now coming with the toxin, like Cholesterodium botulinum can elaborate a powerful exotoxin which is produced intracellularly and is released only on the death and autolysis of an organism. So this exotoxin will become active upon autolysis. So it is probably the most powerful toxin known to the man up to now, because the lethal dose for human being is just 1 to 2 micrograms or even 1 picograms per kg. With a low dose it can show toxic effect. So they are going to target the nerves, so they act as a neurotoxin. Even despite low potency, can act slowly, taking several hours. So it may cause death to the person. So this toxin may be in two form. They can show the effect, emetic form as well as in the diarrheal form. Let us say about the emetic form. They are highly stable toxin. Example is ceruloid, which has a ring structure consisting of 4 amino acid and oxy acids. So it is resistant to heat, pH and proteolysis, but it is not considered as an antigenic. They don't possess antigenic property. Coming with the diarrheal form, so they are also heat and acid labile enterotoxin. So they are basically protein in nature, so that is sensitive towards the proteolytic enzymes. So then coming with the utilization of the substance or discarding of such contamination, food which got susceptible to be contaminated with the botulinum toxin can be rendered completely safe by pressure cooking or boiling for 20 minutes, such that complete death can be seen. But already I told the spores are not more effective, because the spores can withstand the boiling at 100 degrees centigrade even if you cook for several hours. Let us see about the mode of action, how this botulinum toxin can show the action. So they are going to target the nerve, already I told, preganglionic nerve terminal. So they enter by endocytosis. After entering, so they bind rapidly, irreversibly to the cell membrane. So thereby enter into the cell, so inhibit calcium dependent exocytosis. As we know about the calcium, they play a role in the exocytosis. Once it got blocked, so thereby they are going to prevent the release of acetylcholine, and they may result in presynaptic blockage. So thereby diminution of presynaptic function can be observed. So they are going to interfere with all the presynaptic nerves which are cholerogenic, so thereby interfere with the cholerogenic transmission, so thereby they interfere with the normal physiological action. So now coming with the incubation time, it's 12 to 36 hours. Then coming with the clinical features of foodborne botulism, this usually caused in human by the various type like type A, B, E and very rarely F. The initial phase of the disease is often so subtle as to undergo sometimes unnoticed or even sometimes misdiagnosis can also be observed in the initial phase, because it's difficult to identify. Some symptoms can be observed like vomiting, thirst, abdominal pain, constipation, ptosis, even difficulty in visual accommodation. Mydriasis can be seen, and even diplopic condition can also be observed. Dysphonia and dysphagia can be observed. Bilaterally symmetrical descending motor paralysis, and beginning with the abduction 6 can be seen. Also they are going to affect oculomotor nerve 3, because their target is the cholerogenic. All the cranial nerves may be get affected, even they may progress to respiratory insufficiency. Urinary retention can be seen, even mental status may be altered. Sensory examination is essential. Even reflex body temperature and pulse may get abnormal in such condition. Then coming with the treatment, here some serious symptoms can also be observed. So the nature of illness should be identified. If it is because of the botulism, so the patient should be admitted to the hospital and continuous monitoring should be done in reference to the respiratory status, because cholerogenic inhibition can be observed. Vital capacity, peak expiratory flow rate and gag reflex should be observed, and also attempts should be made to evacuate the substances, especially spores which are present in the GIT, and with the help of activated charcoal, emesis can be achieved, or even catharsis can be done, such that we can prevent further absorption of these toxins. Even botulinum antitoxins are available, but in Indian market we are not having that. So only with the supportive care only we should manage the patient. Even guanidine use is controversial, because low efficacy can be seen, and even it's having a high incident of adverse effect. Penicillin G, it's not so much effective in foodborne type of infections. Even human derived botulism immunoglobulins BIG, so it's having some prevalent type action with A, B, C, D and E type. So these immunoglobulins are harvested by plasmapheresis from donors who received multiple immunization. So this is very much effective. Even supportive measures are essential. Even nutrition supplements may be required, like oral feeds are contraindicated in such condition. unless there is intact reflex is observed. Even respiratory support is required for survival in the patient. Next, let us see about the other type of bacteria under microbial food poisoning. We have Bacillus Serratus. So this Bacillus Serratus is an endemic soil dwelling gram-positive rod-shaped beta hemolytic bacterium. So this is well known to cause foodborne illness. So it is an facultative aerobe, and it is like other membrane of the genus Bacillus and can produce protective endospores. So these endospores are highly sensitive towards the temperature. Increasing the temperature won't kill the endospores. Let us see about the spores. Here also we have emetic form as well as the diarrheal form. This emetic form, usually the source is from the fried and cooked rice, pastas, pastry and noodles. So the main source is the rice, so that the rice should not be stored. Rice should be freshly prepared and it should be consumed. If you are storing rice in the refrigerator, slowly the growth of this organism will happen, which will be under noticed, and if you are using such organisms, so 100%, so it will cause us contamination and food poisoning can be observed. And other form is the diarrheal form. So in meat and vegetables we can observe this. Other potential sources of infection may include some of the spices, pasteurized fresh, and some powdered milk also, and also reconstituted milk based some infant formulation can also be act as a source for this type of organism. Let us see about the toxic form. We have emetic form as well as the diarrheal form. Coming with the toxins of emetic form, highly stable toxin, cerulide it is, which has a ring structure consisting of 4 amino acid or oxy acid. It is resistant to heat, pH and proteolysis, but it is not considered antigenic. And also we have diarrheal form, and the remaining information what you have discussed with earlier, it matches the same, like even it is also proteolytic, sensitive to the protein. Coming towards the incubation period, emetic form 1 to 5 hours it is, diarrheal form 8 to 16 hours. Then clinical feature, emetic form causes nausea, vomiting, whereas diarrheal form causes diarrhea, which is watery stool, abdominal pain, and occasionally nausea can be observed. Fever is uncommon in both the forms of organism. In rare cases, even liver failure and even developed some Serratus form, emetic toxins can cause some food contamination. Only in rare cases the liver failure can be observed. In one of the retrospective case studies, so it is observed the patient who got developed with the infection of Bacillus Serratus, wound infection. So they have got some hemorrhagic drainage, and it was lasted for 1 to 3 weeks. In them, endocarditis has been reported following with the intravenous drug abuse. Even valvular heart diseases have been observed with Bacillus Serratus wound infection. Then coming with the diagnosis for foodborne illness, stool culture, and it should be grown in MYPA medium. The M represents a mannitol, and egg yolk, phenol red, and polymyxin agar is used for the cultivation of the bacterium. With this we can diagnose. Even diagnosis can be confirmed by detecting the organism in the suspected food items. Then coming with the treatment, it is common with all type of food poisoning. Here supportive care measures should be considered. Even the disease is very mild or self-limiting. Then you should monitor fluid and electrolyte status, and even hepatic enzyme should be checked, because already the organism can cause emesis and diarrhea. So fluid monitoring is essential. If found decrease in the fluid level, so immediately it should be get treated. And even hepatic enzyme detection will help us to identify about the health status of the liver, because some organisms they have a property to destroy the liver. In rare cases this can be observed. Even patient with a mild fluid deficit can be managed with the oral fluid therapy. In previous general introduction, we have seen about the dosage of the